The Wahls Protocol 101. Learn how to use diet and lifestyle to create health and vitality for your life. I'm Dr. Terry Wahls, and welcome to this webinar. So here's my disclaimer. The statements and products shown in this presentation and on my website and in my books have not been evaluated by the U.S. Food and Drug Administration. These statements and products are not intended to diagnose, treat, cure, or prevent any disease. I expressly disclaim all liability with respect to actions taken or not taken based on any or all of the information or contents of these materials. They are for education and informational purposes only and are not intended as medical advice. This information does not create nor is intended to replace a relationship with a qualified healthcare professional. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding your medical condition or your health prior to starting any dietary routines, exercise, or supplements. Now, in this webinar, I will review some common health issues, my story. I'll talk about functional medicine, how it's different, how to begin 3 easy actionable steps that you can use to begin creating more health and vitality, and how you can find additional support for your healing journey. So, are you worried about your immune health? Now, the Centers for Disease Control and the World Health Organization have identified increasing risks to immune health if you're over the age of 60, if you're taking immune-suppressing medication, if you have chronic lung disease, particularly if you're also a smoker, if you have elevated blood sugar, diabetes, or heart disease. And is this you or someone in your family? And we have millions of Americans, 25 million with a serious autoimmune condition, another 50 million with a autoimmune disease process with autoantibodies and many symptoms. And many of these folks are on immune-suppressing drugs, and they're getting increasingly concerned about the use of immune-suppressing drugs. Now, what if there was an alternative to taking these immune-suppressing drugs that could lower the severity of symptoms and also potentially lower the amount of autoantibodies that are made? Would you want to learn more about that? Also, what about hidden inflammation? You see, hidden inflammation, again by the CDC and the WHO, hidden inflammation has been identified to increase the risk of complications related to COVID, diabetes, heart disease, and many other chronic diseases, including depression, autoimmunity. So you're probably wondering, do you have hidden inflammation? Well, do you have any of these annoying symptoms? Troubling pain, worsening fatigue so that you have to rely on energy drinks to get through the day, mood problems. Is it harder to get along with your family, with your coworkers? Are you anxious? Are you depressed? Have you been having more problem with memory, with concentration, with brain fog? These are incredibly common symptoms, and you might just have the symptom, or they may be part of a chronic disease state that you already have. And did you know that hidden inflammation looks like these problems? Chronic pain, worsening fatigue, difficulty with mood disorders, or mood symptoms, and problems with memory. It's very clear that excessive inappropriate inflammation is a part of these symptom complexes. Now, for years, I ran a therapeutic lifestyle clinic at the VA, and we used diet and lifestyle as the main intervention for our patients. And patients came to us with severe diabetes, severe obesity, heart disease, that might be heart failure, angina, cardiovascular disease, neuropathies, and there wasn't just the diabetic neuropathies, there were small fiber neuropathies, chronic pain from a wide variety of sources, including war injuries, autoimmune disease, memory problems, early cognitive decline, and consistently people had reduction in their pain, improvements in blood pressure, improvements in blood sugar, in reduced need for pain meds, and they're able to steadily reduce their prescriptions, both the doses and the number of prescriptions. And their primary care doc and their specialist doc would say, like, oh my goodness, whatever you're doing, keep it up. You are making such wonderful progress. Again, the symptoms people were most helped: fatigue, brain fog, pain, mood, memory problems. And we'd see people every month. And within that first month, when people came back after seeing us, they could tell us that for the first time in years, sometimes in decades, they were having hope because their energy was improving, their mood was improving, their pain was reducing. So, are you suffering with fatigue, brain fog, pain, irritability, mood problems, memory problems? You're not alone. Hidden inflammation is a very common problem. These symptoms are a very common problem. Did you know 80% of Americans are taking prescription medication for pain, for fatigue, or mood problems? And over 25% of our children are taking prescription medications for mood and behavior. And I understand how you feel. I have a serious autoimmune disease, and I took disease-modifying drug treatments for years. And here's my story. So, in 2000, I developed some new issues with my left leg. It was not quite as strong. I was beginning to stumble. I had a big workup. I saw my primary care doc. I ultimately was referred to a neurologist. I had MRIs of my brain and my spinal cord and lots of other blood tests as well. And there were lesions in my spinal cord. I had a spinal tap. And then the doc went back through my record and said, you know, in 1982, you had trigeminal neuralgia. In 87, you had a dim vision in your left eye. This is really relapsing remitting multiple sclerosis. And I knew that I had an aggressive disease. Or I should take that back. I knew I had a progressive disease because the natural history of MS is to gradually decline. And I wanted to treat my disease aggressively. So I did my research. I wanted to know who had the best MS center in the country that was doing clinical research, and who was their best doctor. And so I went to the Cleveland Clinic. I saw their best people. I took the newest drugs. And I went downhill anyway. By 3 years, I needed that tilt-recline wheelchair. And at that time, the reality was that most people with MS would convert to secondary progressive multiple sclerosis within 10 years of diagnosis. And they would develop problems with mobility, fatigue, quite often also pain, and they would be at higher risk for cognitive decline. So now you know why I was so eager and willing to treat my disease aggressively. Now, if we look at autoimmunity, and we look at chronic disease, we see that despite getting better and better drugs, the rates of autoimmunity continue to increase. The severity of disease continues to increase. The age at first diagnosis continues to decline. And the cost of these drugs are getting more and more expensive, and they're more powerful, more specific. These are now second-generation drugs. They target very specific receptors and pathways as we understand the biology of autoimmunity and many of our chronic diseases more specifically. And these drugs are expensive, $45,000 to $100,000 a year. It's a $6 billion per year industry and growing. And they provide ever more potent immune suppression, which means they are increasingly effective at turning off disease activity, or at least the acute inflammation. But because our immune cells are a vital part of our function of how a healthy body should work, if you turn off the immune cells, you end up with very significant side effects, which may affect your heart, your mood. You are at higher risk of infection, higher risk of cancers, and you're at higher risk of developing more autoimmune diseases. But people don't want to become disabled by their disease, so they're happily taking these drugs. I know. I was that person. But these drugs are helpful temporarily. Rheumatoid arthritis is the serious autoimmune disease that has the longest experience with these potent biologic drugs. And what we know in the rheumatoid arthritis arena is that sustained remission from drugs is actually very uncommon. Less than half will remain in remission for longer than 1 year. And remission greater than 2 years is rare, less than 14% of patients. So what we really need to do is to get at the root cause of what's activating this altered immune function if we want to regress these chronic diseases. Because apparently, while we can turn off the acute inflammation, another problem will develop and resistance to the effectiveness of that drug emerges. I love this cartoon because it helps us understand that it's a very complicated mess in terms of why autoimmune disease develops. Whether it's MS or ulcerative colitis, inflammatory bowel disease, cardiovascular disease, type 1 diabetes, rheumatoid arthritis, or any one of the hundreds of different autoimmune conditions, or frankly, any one of the hundreds of chronic diseases that are not directly infectious. We know that we have a genetic predisposition, and for any one of these chronic diseases, whether it's diabetes or MS or rheumatoid arthritis, that's about 200 to 300 genes that increase your risk ever so slightly. But each gene, it might be only an increased risk of 1% or 2%. The vast majority with that gene do not get the condition. It's this complicated interaction between the genes you got from mom and dad and a lifetime of diet choices, antibiotic exposure, the microbes living in and on your body, your vitamin D level, your infections over your lifetime, your medications over your lifetime, your smoking status, your physical activity level, your social networks, that all of that interacts with your gene expression. The food you eat fertilizes the microbes in your gut, and you get either health-promoting microbes or disease-promoting microbes. And those microbes and your genes and your environmental factors all influence your immune cells. which in turn will support greater health or greater risk of autoimmunity and greater risk of excessive and inappropriate inflammation. We can't change the genes we have from mom and dad, but we can address many of our environmental factors. And that is what we address with the functional medicine tree. As a physician, I'm very well trained to take a specific set of signs and symptoms in the patient to make a diagnosis and then treat them. And when I can no longer effectively manage their symptoms, refer them on to an organ-specific specialist. What I really like about the functional medicine paradigm is that it helps us understand all these environmental factors, how they interact with my genetics, and how that interacts with the events of my life that can lead to how my cells run the chemistry of life, either effectively or less effectively. And that those symptoms will affect how my organs work, which then lead to the signs and symptoms and then lead to the diagnosis. And I can address the environmental factors. I can support the organs using diet, lifestyle, and at times prescription medicines. But by addressing these root causes, we often find that the organs steadily improve their health and vitality. Now, these are the big four that I first focus on: nutrition, exercise, sleep, and stress reduction. And when I did that myself, it was remarkable. In 2007, I was so weak I could not sit up in a regular chair. I had a tilt-recline chair, and then I had a zero-gravity chair at work where my knees were higher than my nose. I had one at home, one at work. I was beginning to have more problems with brain fog. I have trigeminal neuralgia, and those pains were more frequent, more severe, and far more difficult to turn off. But after a year of an integrative approach that used functional medicine, ancestral health, evolutionary biology principles, and what I'd learned from my basic science readings, and I've really focused on diet and lifestyle, stress reduction, exercise, I was able to get on my bike and start biking again. In fact, I was able to do an 18.5-mile bike ride with my family. You know, my son's crying, my daughter's crying, my wife is crying, and I'm crying because it had been at least 6 years since I'd ridden my bike due to the severe disability related to the MS. So here's my timeline in retrospect. My first bout of face pain began during medical school in 1980. And over time, that would gradually become more frequent, more severe, and more difficult to turn off. In 1987, I had an episode of dim vision in my left eye. In 2000, I had left leg weakness, big workup, the MS was diagnosed. I immediately began taking disease-modifying drugs, and I was seeing the best people in the country. In 2002, I was introduced to the Paleo diet, and I had been a vegetarian, low-fat vegetarian for 20 years. I started reading more ancestral health principles. I continued to decline. The next year, I needed the tilt-recline wheelchair. I took chemo. In 2004, I added various supplements, and I was taking Tysabri. I continued to decline. I switched to other potent disease-modifying drug treatments. In 2007, I discovered functional medicine, and I added those supplements. And then I had the really big aha moment was that I should reorganize my paleo diet based on what I'd learned in basic science and functional medicine. And what I really did was I integrated functional medicine, ancestral health, evolutionary biology, and reorganized all of that into the Wahls Protocol. And I began to have remarkable improvements in strength. My fatigue was gone, my pain was gone, my brain fog was gone. And with my neurologist's blessing, I tapered and discontinued my disease-modifying drugs. And I've been on 0 disease-modifying drugs since 2008, and I continue to get stronger. My chair of medicine said my recovery was so remarkable because I'd had 4 years of secondary progressive MS. And so we got the case report written up. Then we wrote a case series. And then we did what's called a safety and feasibility study, showing that my intervention could be implemented by others with progressive multiple sclerosis. And they did well. Then we did a randomized controlled trial. Well, people came in, we did their assessments, randomized them. We gave them just the diet and compared the 2 groups. And again, found that the intervention led to improved quality of life, improved physical health, and improved motor function. And we have improved mood and thinking ability. So again, what I've created is an integration of what I've learned through evolutionary biology, ancestral health, functional medicine, basic science, and then more recently I've added the science of behavior change because I recognized when I was teaching these principles to my patients that we needed to have a lot more support for helping people more effectively create these desirable habits and extinguish the undesirable habits. Let me tell you about a couple of folks whose lives we've transformed. Wahls warrior Annette is someone with secondary progressive MS who was struggling with fatigue, who has a small business and was thinking that she was would soon have to give up her business because it was just so difficult to function. We got her implementing the diet, the lifestyle, and the first thing she saw was her energy improved, her mental clarity improved, her mood improved, weight fell off without being hungry. She got back to a healthier weight. The blood markers also improved. Her life completely transformed. Kirsten is a youngster, developed serious autoimmune issues. Her mom, fortunately, figured this out, put her on a gluten-free diet, and things significantly improved. She'd had big skin rashes, it had failure to thrive, couldn't absorb nutrients, lost weight, but once she was on this gluten-free diet, her skin improved, her digestion improved, and she grew and performed well in school. And then, like many young people in junior high, she began to be more independent and began to eat other things when she was away from home. And her skin became inflamed, had many, many rashes. Her gut became inflamed. She was having more pain. And this time, her mom put her on the Wahls Protocol, put the whole family on the Wahls Protocol. And Kirsten's skin resolved. Her fatigue and mood changes completely resolved. Her gut pain completely resolved. And Kirsten realized that she felt so much better on the program that she figured out how to keep this going as she entered high school and thrived in high school. And she also learned that if she had an indiscretion, she felt bad. And fortunately for her, her skin also told her very quickly that she had an indiscretion. And fortunately for Kirsten, because the whole family did this, it was a much easier success. Now the truth is, most people with MS, any serious systemic autoimmune issue, will eventually face worsening pain, fatigue, depression, anxiety, much higher risk for cognitive decline, and excessive weight, which will accelerate and worsen the disease course of MS. But this is true for rheumatoid arthritis, psoriasis, in any of the hundreds of other serious autoimmune conditions. And unfortunately, we see the same scenario with the hidden inflammation that is part of high blood pressure, diabetes, obesity, chronic lung disease, anxiety, and depression. So, now for the things I told you I'd give you at the end. Some actionable things that you can do. The first thing I want you to reflect on is, what do you want your health for? That is a profound question. If we could improve your health a little bit, what would you do with that improved health? So let's think about how we can help you create more health. So if the goal is creating health, where can you start? Let's give you 3 easy, actionable steps. First, let's have you write out the answer. What will you do with better health? Think deeply and make it realistic. I'm not going to fly like a bird. And I'll tell you, as I was struggling with all of this, I had young kids. And so I wanted to be able to do things with my children. And I wanted to help them grow up to be successful, healthy adults, emotionally healthy, and physically healthy, and financially healthy. What do you want? What would you like with your health? 2, let's improve the quality of your diet. So remove an inflammatory food group. And you could remove sugar, replace it with fruit, and you could remove gluten or dairy or both. And you can think about, you don't have to do all 3. Pick one and start with that. And number 3, add more non-starchy vegetables. Your grandmother and your great-grandmother and all of your ancestral mothers knew that eating more vegetables was good for their clan. So, add more greens, cabbage, beets, mushrooms. Find some vegetables that you enjoy and get more of them in your day. And I want you to keep learning. Realize that you have control. Take control of your health. Take control of your learning. Go to terrywalls.com/diet. You have a great download there. And terrywalls.com/seminar. You can learn more about programs that we offer. Follow me on Facebook and Twitter at Terry Wahls. Follow me on Instagram at Dr. Terry Wahls. And go to YouTube, Terry Wahls MD. And again, you can see lots more information that I put out about what I'm eating, what I'm doing, talking about the research. You'll learn a lot of very helpful tools to keep you inspired about what is possible. And pick up my books, The Wahls Protocol, A Radical New Way to Treat All Chronic Autoimmune Conditions Using Paleo Principles, and the Companion Cookbook. And many people, some people can pick up a book read it, take it all to heart, and utterly transform their lives. Many more will benefit from some additional support for their healing journey. So you could come to our membership site and you get to submit questions. We have video lectures, sometimes it's audio lectures of where I am talking around the world. And that really is a phenomenal support. Couple it with the Wahls premium menus. And this is a great deal. You can get access to the membership for a year and the premium menus at whichever level of the diet that you would like. And the menus have recipes, menus, shopping lists to help you have a diverse diet that meets these goals. It is just fabulous nutrition, very fun and very easy. You could come to our live 3-day event, seminar and retreat. Hundreds and hundreds of fellow travelers on this journey, health journey, come learn from me. We practice skills, we sing, we dance, we laugh. It is a transformational experience. We have beginners and advanced track. As a group, we talk about functional medicine concepts. I help people complete their timeline and reflect on what are their environmental exposures that are likely the most impactful on changing how well their cells can do the chemistry of life. And we keep the topics and schedule up on the website. It's a place to create community, to develop and practice the skills that are needed to more successfully adopt and sustain the Wahls Protocol, and to learn the latest research in MS, autoimmune disease, many other chronic diseases, and mental health issues. And you also get to hear the latest research that's going on in my lab. Or maybe you want to have a more personalized approach with a Wahls certified health professional. So again, if you go to our resources, you can look through the health professional directory and look for someone who can evaluate you, provide more specific guidance on food sensitivity issues, toxin exposures, hormone balance, and address all of these factors as precisely as possible. Or do you want to come work with me individually? We do have a small private practice where I'm seeing patients directly and performing a medical assessment and recommendations so that we can really get to the complete understanding of your unique issues, including all of the environmental factors that contributed to your health circumstances right now. And of course, the more support you have from me and my team, the more expensive these interventions are. We have many options for you. Again, learn more, follow me, check out terrywahls.com/seminar for seminar details. Follow me on Facebook, on Twitter, and on Instagram.